And thank you very much for your patience. One of technical issues, but now all is back on track. So hello and welcome. My name is Christian Vella, and I will be moderating this session as part of INEA's webinar 2020 series, which is run under the theme Population Aging, Diversity, Justice and Equality. Today, our invited speaker is Professor Sonia Ouali Hamami, and she will be talking to us about population aging in North Africa. Professor Sonia Hamami is a pioneer geriatrician and she's chair of the Tunisian Geriatric Association and chairman of the International Medicine and Geriatric Department within the University of Montazir in Tunisia. Professor Hamami is a consultant for the Tunisian government on healthcare for its older population, as well as a consultant with the UNFPA and as well as WHO. Her research focuses on metabolic disorders in older persons and the epidemiological research on Alzheimer's disease and sarcopenia. Currently, she is also a member of a number of committees, including the coordinating committee of the Tunisian group with the Ministry of Health, and which is set up to develop gerontological and geriatric education at undergraduate as well as postgraduate level. She also herself founded the geriatric diploma with the University of Montazir. Professor Hamami has written various publications, book chapters, as well as published various abstracts. Along the years, she has become, invited to various international meetings, as well as also organizing various meetings and conferences and events as well in Tunisia. And now, before I start, I would like to run a couple of house rules in order to ensure that this session will be run as smoothly as possible. So basically, to start off with, on the chat panel here, I do encourage everyone, to introduce yourself and as well as the organization which you form part of. And during the session, the speaker, she will be using the PowerPoint as we all can see. So it's recommended that you choose the screen, that you will choose the speaker view as the preferred option. The floor will be now given to the speaker for the next 45 minutes, whereby she will delve into her presentation. Following that, then we're going to have a 10 minutes question and answer. And during the question and answer time, you're kindly asked to, place your questions within the Q&A panel. Alternatively, you can also voice your questions by clicking on the hand icon in the participant panel, whereby here we'll do our best to attend to as many questions as possible. And if there will be any remaining questions, I shall also be displaying my email address, whereby then following this session, then you can email me your questions and we'll do our best to answer them for you. On behalf of INEA, I do hope that you'll find this session interesting. And now, finally, I would like to pass on the floor to Professor Sonia Hamami.
Thank you, Christian, for this introduction. I'd like to thank Professor Farmouza, my dear colleague Rosette, for this kind invitation. It's really a pleasure for me to participate to the INEA webinar series. And I'd like also to pass a warm welcome to all the participants from the world. So I am presenting today the population aging in North Africa. And as you know, research in this field has been still sparse. I'd like to talk in this topic about demographic profile, the consequences of aging in the region, the role of the family, and the barriers to healthy aging. And we conclude with some recommendation. So we start with the demographic profile. And as you know, the population are getting older everywhere in the world. And the number of older adults will increase from 10% in 2000 to more than 20% by 2050. The life expectancy at the age of 60 years will be more than 20 years by 2030. What's about North Africa profile? North Africa is a geographical area located in the northern part of Africa, include a large part from Morocco until Egypt. We can divide this region in two groups. The first one, called the Maghreb, include Morocco, Algeria, and Tunisia. This part, characterized by a French colonial time and speak both Arabic and French. It is also characterized by a fast speed of aging. And the second part, most of them are Arabic and English speaker and have a moderate speed of aging. Egypt and all the region have the highest population and the largest population. As you can see, in the last decades, the number of the North African population increased and projected to increase steadily in the future. Demographic aging in the region represent an emerging question, but until recently, little attention has been devoted to that issue, even when we know that the number of older adults grow rapidly compared to other countries worldwide, and the number of older adults will be more than quadruple by 2015. In my presentation, I try to present the results from the World Demographic Prospect 2019. And in this graph, as you can see, the number of older adults increased steadily the last decade and will increase more in the future. And on the other side, the number of younger people, this is the number of older population, and the number of younger people will decrease in the future. The shape of population pyramids change over the time from the triangle form to a block form with a narrow basis. And at the same time, in the future, the number of oldest adults who have more than 80 years and above will constitute more than 50% of all the older population. Aging in North Africa is the result of many contributing factors, like rapidly declining in fertility rates, rapidly declining in death rates, and increasing life expectancy and rising median age. This slide shows the decline of both growth birth rate and growth death rate in North Africa. And in this chart, as you can see, we have in the region, in the North Africa region, a decline in total fertility, and the number of children per family will decrease from 7 children per family maybe 5 decades ago to 3 children per family now. And at the same time, the life expectancy at birth grows steadily and continue to grow in the future. And when we compare between 2000 and 2000, by 2040, the number we have 10 years in life expectancy at birth. So the regional average life expectancy at birth is projected to improve by almost 10 years. And when we compare the life expectancy at birth between male and female, the life expectancy is more important for female compared to male, leading to feminization of our society. This is not really good for female because they accumulate at the same time more chronic diseases, frailty, psychological and social problem. The median age allowed to separate the population in two equal groups, the younger one and the oldest one. And as you can see in the histogram, in the future and by 2015, the median age increase and we reach around 40 years for Tunisian and Egyptian populations. Tunisian compared to Africa countries have the lowest fertility rate. And as you can see, in only one generation, we go from 7 children per family to less than 2 children per family in 2000. And in the future, the number, the rate will be stabilized. And when we compare with other North African countries or other countries in the continent, there is a big difference. And at the same time, the life expectancy at birth will increase compared to other Northern African countries. When we try to compare between North African countries or other countries in the continent, we saw that in 2000, the life expectancy have been about 50 years for Africa continent, 65 for North Africa continent, and 75 years for Tunisian people. This histogram demonstrates the fertility rate in North Africa countries which decline faster than they did in rich countries. And when we try to compare some countries from North Africa like Tunisia and Morocco, the time that we need to decrease the number of children from 6 to 3 is about 21 years. And when we compare with United Kingdom, they need about 100 years to decline from 6 children to 3 children. Older population in North Africa countries are increasing also faster than they did in rich countries. And when we take the example of Tunisia, we need 24 years to increase from 7% to 14%. And on the other hand, when we compare with France, they need more than 110 years to double the population of older adults. What's about the profile of older adults in the region? Most of older population have a bad situation, economical, social, psychological. Most of them are illiterate, and we can see in the table the rate of illiteracy, which reach more than 86% in Algeria, 70% in Morocco. And it concerns more rural region and women compared to men. This is an example from Tunisia to look in the characteristic of the older adults. Most of them live in urban area, and most of them, maybe 60%, are married. Older adults, even after retirement, they continue working. So 22% continue working even after retirement. And most of our population live still now with family, with partner, or with children. Demographic transition have many consequences in the political, environmental, social side. Increasing elderly population leads to a significant consequences for the cost and for the organization of health system. And this time, population aging is highly correlated with an increase in the prevalence of a number of long-term chronic conditions like chronic diseases, diabetes, hypertension, dementia, and we have also an increase in physical and mental disability and in prevalence of dementia. All this increase personal care needs. This slide shows the challenge in the field of diseases. And as you can see, the burden of diseases related to non-communicable diseases has grown rapidly in the region, particularly in Tunisia. And at the same time, the communicable diseases decreases in all the country and is still high in Mauritania. With the demographic transition in the region, we face an epidemiologic transition with more chronic illness for the population older than 65, like cardiovascular diseases, diabetes, and Alzheimer's disease and dementia. And according to the Demographic World Prospect 2019, the leading causes of death in the Maghreb are cardiovascular diseases, dementia, and diabetes. The dependency ratio increases in the region, and as you can see in this table, the old age dependency ratio will reach about 16 in Algeria and more than 20 in Tunisia. And we have also an increase in economic old age dependency ratio. And by 2013, it will reach more than 20% in Morocco and 23% in Tunisia. And in this histogram, we can see that the Northern Africa region is the highest one in the world in the old age dependency ratio. We have now about 8%. By 2013, it will reach 11% and 18% by 2015. And this is the highest percentage worldwide. With demographic transition, epidemiologic transition, and the region, we face a socio-cultural transition. This transition is related to many factors like modernization, urbanization, migration of youth, increased work participation of women, and growing individualism. So urbanization leads to many modifications and changes in family structure, including living arrangement. 2 or 3 or 4 decades before, in all the North African countries, most of the family live with 2 or 3 generations, which is difficult to do in this time with the change in family structure going from extended family to nuclear family. On the other hand, migration for economic, political, and other reasons will increase the aging problem. As an example, for Tunisia, from the beginning of COVID-19, from the beginning of COVID-19, more than 5,000 young people leave Tunisia to go to European countries. This graph shows the urbanization in North Africa, and as you can see, Tunisia is one of the most urbanized regions in the North Africa country. Change in family structure, as I described it, moving from extended family to nuclear family, have more and more impact in our older population. The modern family has undergone changes by moving away from traditional roles. It's normal because, as I said, the number of children decreases drastically this last time. And before, we have about 6-7 children to take care about parents. And now, actually, with nuclear family, we have 1 or 2 to take care of 2 grandparents or 4 sometimes grandparents. Now we move to know more about healthcare system. In some countries like Tunisia, Morocco, Algeria, Ministry of Health since 1900 start a program for the geriatric patient. This program offers full geriatric medicine intervention for older adults with geriatric profile. But still, until this time, we don't have geriatric specialty in all the country of North Africa. And geriatric care is maybe inexistent in Mauritania and in Libya and in other countries of North Africa. And the same countries of Maghreb, Tunisia, Morocco, Algeria, national policy for older population offer help for older people and try to focus in healthcare for older people. and help this population with financial security, improving healthcare, improving nutrition, children. They encourage education for older adults, welfare, and they promote research and training in the field of geriatric, and encourage family support. But this requires a considerable amount of resources from governments and family, which is really, in the economic crisis, not really easy. Governments still spend far less per capita on health care and social protection. And as you can see in this table, the total expenditure on health per capita in dollar is very low for some country like Mauritania. Few North African countries have public pension programs or formal system for caring for the elderly. Most rely on traditional family structures. And older adults typically need to work even past traditional retirement age because they don't have enough income. And a little percentage participate to the pension. And as you can see in this table for Morocco, the participation for the pension is about 20%. Aging and pension coverage in North Africa countries is now the lowest one in all the MENA region. Populations are not able to afford the cost of access to healthcare and housing. Social protection system covering a small proportion of the population, and pension system covering only fewer than 20% of retirees. So seniors in most cases do not enjoy a pension or healthcare coverage. And as you can see in this table, the labor force participation of persons aged 65 and above is very high in some countries like Mauritania. The lower rate is in Algeria, and the female have the lower rate compared to male. Only in Morocco region, in Morocco country, the female still working even after the age of 65 years. What about the role of the family? Even in the economic crisis, even in the social and psychological crisis, the family have a good place to take care of older adults. So according to traditional cultural values, we still have admiration for elderly people in our family. And we take care of older adults in the same family, and in the same moment, the older adults control children in family and help parents for education for children. However, what has become evident in recent time is the way in which family structures are changing. So changing family structure resulting in shrinking social support networks that many older have dependent upon for generations. And with increasing urbanization, the support network is being dismantled. Rapidly increasing new category of neglecting elderly individuals and older adults living alone without any caregivers. And this is an example from Maghreb. Vulnerability concern more. Vulnerability concern more old age women and elderly living in rural areas. And we have a chance. In some countries, there are many programs to assist needy older adults and needy families, given indirectly to the older adults who lives with a supporting family member, like the example of Tunisia. The care roles of men and women in the context of population aging are varied. And the general perception is that older people are care receiver while younger ones are caregivers. And Islam, our religion, also places a considerable duty of elderly care, particularly financially. But recent evidence in the region suggests that older people are increasingly also playing the role of caregiver as much as they are care receivers. So most of the time, older adults who have pension help the younger people and help the younger couple to manage family. What's about the role of women in North Africa? As you know, women with their traditional roles of wives, mothers, or daughters-in-law are usually portrayed and expected to be the main source of emotional and care support. Women still providing most formal and informal care. And I note that I underline that informal care is still the most common form of care provision with the region. And even in the hospital, family and particularly women help with eating, washing, and this help is often provided by women rather than nursing staff, even in the hospital. NGOs helps a lot family to manage the problem for older adults, and there are many associations, especially in the Maghreb region, to protect older adults. But the problem that most of the association fight most of the time the finding problem. The Ministry of Public Health, the Ministry of Family, and sometimes private donors can help the NGOs to protect and to give happiness and older people. This is an example of association in Morocco, age association in Morocco, which offer healthcare, social and psychological support for older adults. They provide happiness and comfort for older people. So we need to encourage the invest more in creating institutions for elderly. We need to encourage all the NGOs to be more active and to help more older adults. What's about nursing home? As you know, the situation in North Africa is completely different compared to European countries, because of our religion and our tradition, nursing home looks as an abandonment of our older adults. And as said Hassan II, the past king in Morocco, the day we open the first nursing home in Morocco, our society will be in the process of disappearing. But what we can see said that there are a growing number of old people living in senior charity homes. Most of the homes are under the control of public sector, but the last decades, some private people are interested to create a nursing home. But the big problem that in the region that most of the homes are not really well organized. The majority of these homes are inorganized and do not respect human rights, and most of the time overpopulated. What's about the situation after the Arabic Revolution? After a revolution, we face barriers to healthy aging in North Africa most of the time. This is related to ageism, to inadequate policies, to lack of accessibility to housing, transportation, social facilities for older adults, inadequate or absent services for seniors, and lack of consultation and involvement older adults in all policy decision. We note inequality, a big inequality between older adults in North African region. As you can see, after revolution, most of North African region and the Maghreb region have oldest president, leading to bad governance and corruption, young unemployment, lack of freedom of opinion, increase of food price, and increase of poverty. So North Africa and after the revolution has a long way to go. We face many challenges, higher demand for health and long-term care, strain on pension system, threat to economic development. We need to work hard to improve the situation of older adults. We need policy change to respect the World Health Organization recommendation, like the place of older people at the center, to place the older people at the center of healthcare, to ensure the quality of long-term care, support healthy aging and combat ageism, and improve understanding of the health states. But in this situation with the COVID-19, and as you know, this infection fight especially the older population, and this infection have a high impact in this people, with a huge number of deaths, with an important number of poverty related to the economic crisis combined with the COVID-19 pandemic. So with this situation, we need to work hardly to help older population and to improve their quality of life. So we conclude with some recommendation to help older adults and to improve older age to be more meaningful and more impactful. We need to improve policies and the program, and especially its enforcement, to support for socialization program, enhancing coordination between the interrelated program by the government and the private sector, and the efforts to improve the health of elderly. We need quality aging program, and we need finally to direct support to selected NGOs that has concepts on and capability to help older adults. And thank you for your attention.
Thank you very much, Professor Hamami. That was a very much in-depth, very interesting presentation on population, the challenges which population aging is having on within North Africa. So diverse changes not only in the family structure, but which affects ultimately the entire society, which yes brings about a great call for action. For everyone to really put their hands, to work and really to provide as best care as possible for the older populations. Now I would like to open up the floor to the questions which our participants may have. So we have roughly 10 minutes maybe for the questions. I'd also like to remind you that you can also type your questions within the question and answer panel as well. And we have actually the first question from Professor Mala Shakandras. Of course, she thanks you for your presentation. And she asked, you refer to the violation of human rights and the prevalence of ageism in North Africa. But can you also elaborate on the specific instances of elder abuse which are occurring? And is there any noticeable gender differences in this aspect? Also, if are there any particular legislative measures which have been adopted in order to combat elder abuse?
Thank you for this question. As I said in the beginning of my presentation, research in the region and the field of aging is very, very sparse, and we have a few research, and it was really not easy to have all the document for my presentation. But what we see, and particularly Maghreb region, that we have really ageism in high prevalence in the Northern Africa countries. The situation of older adults really very bad, especially after the revolution. And for elderly abuse, we don't have any statistic in the field, but when we saw in the region, and particularly in Tunisia, through our patient, we have prevalence of elderly abuse. But talking about Islam and tradition in the region, it's forbidden to discuss and to talk about the elderly abuse, really, because even when we discuss with family, they refuse, and they don't talk even for older adults about different form of abuse. And I think for the difference between a gender, there is no difference between, it's the same for male and female, for ageism and even for elderly abuse. So we need to work hard and to promote research and this field. We need to work and to have some statistic in the field.
Thank you very much, Professor Hamami, for that. Do we have any more questions? I mean, the comments that I have here is that, of course, your presentation was very, very good. It was excellent. So I think, it was in so much detail that
Thank you,
you
Christian.
already answered, people's queries. And
thank you for all the participants.
okay, so since there is no more questions, I guess we can bring a close to this session. And on that note, I would like to, thank everybody for, attending this very informative presentation. And now I'd like to also, we have one question. Yes, we have a question, okay, from Radwan Goya, and the question here is Tunisia currently preparing, if I can understand it correctly, is Tunisia preparing for a law as regards to elder abuse and their rights? Is there some sort of legal, framework which they're coming about as regards to elder abuse?
What's the question of?
As it's also about elder abuse. So the participant here is asking, if there's a law being drafted or being created in order to protect older persons from abuse.
Yes, as I said, we have elderly abuse. And recently, the example of Tunisia, we saw some elderly abuse in the nursing home. But until this time, we don't have research in the field, and we don't have really a number or statistic to evaluate exactly the situation of elderly abuse in the region. And I think it's really important to start some study and to have idea about elderly abuse, about ageism, about the difference between gender. I think we lose many opportunity to start working in this field. And we need to have some statistic to evaluate the situation in North Africa. So we invite all my colleagues from Tunisia to start working in Tunisia and in the North African region to start working. Why not to start research in this field?
Thank you very much, Professor Hamami, for that. So I guess we could bring this session to a close with that question as we're out of time. So thank you very much once again, Professor Hamami. And I'd like to also have the opportunity, to remind our participants that today week on the 25th of November, we'll have another session, and the speaker would be Professor Jose Ricardo Juare, who's also the president of the International Association of Gerontology and Geriatrics, who will be joining us to discuss the impact of COVID-19 pandemic on older persons and as well as institutions in Argentina. Those interested are, to find much more information on our Facebook page as well as on our website, and we invite you once again to register for today's week session. So thank you once again, and I look forward to seeing you next week. Thank you.
Thank you very much. Thank you.